Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 30 practice questions. Without the way, let's get started.
A client with angina is taking nifedipine. The nurse should teach the client to 1. Monitor blood pressure monthly. 2. Perform daily weights. 3. Inspect gums daily. 4. Limit intake of green leafy vegetables. The correct answer is 3. Inspect gums daily. Rationale. The client taking nifedipine should inspect the gums daily to monitor for gingival hyperplasia. This is an uncommon adverse effect, but one that requires monitoring and intervention if it occurs. The client taking nifedipine might be taught to monitor blood pressure, but more often than monthly. These clients would not generally need to perform daily weights or limit intake of green leafy vegetables. A client has a throbbing headache when nitroglycerin is taken for angina. The nurse should instruct the client that 1. Acetaminophen, Tylenol, or ibuprofen, Advil can be taken for this common side effect. 2. Nitroglycerin should be avoided if the client is experiencing this serious side effect. 3. Taking the nitroglycerin with a few glasses of water will reduce the problem. 4. The client should lie in a supine position to alleviate the headache. The correct answer is 1. Acetaminophen, Tylenol, or ibuprofen, Advil can be taken for this common side effect. Rationale. Headache is a common side effect of nitroglycerin that can be alleviated with aspirin, acetaminophen, or ibuprofen. The sublingual nitroglycerin needs to be absorbed in the mouth, which will be disrupted with drinking. Lying flat will increase blood flow to the head and may increase pain and exacerbate other symptoms, such as shortness of breath. Which of the following is not a risk factor for the development of atherosclerosis? 1. Family history of early heart attack. 2. Late onset of puberty. 3. Total blood cholesterol level greater than 220 milligrams per deciliter. 4. Elevated fasting blood glucose concentration. The correct answer is 2. Late onset of puberty. Rationale. Late onset of puberty is not generally considered to be a risk factor for the development of atherosclerosis. Risk factors for atherosclerosis include family history of atherosclerosis, cigarette smoking, hypertension, high blood cholesterol level, male gender, diabetes mellitus, obesity, and physical inactivity. The physician refers the client with unstable angina for a cardiac catheterization. The nurse explains to the client that this procedure is being used in this specific situation to 1. Open and dilate blocked coronary arteries. 2. Assess the extent of arterial blockage. 3. Bypass obstructed vessels. 4. Assess the functional adequacy of the valves and heart muscle. The correct answer is 2. Assess the extent of arterial blockage. Rationale. Cardiac catheterization is done in clients with angina primarily to assess the extent and the severity of the coronary artery blockage. A decision about medical management, angioplasty, or coronary artery bypass surgery will be based on the catheterization results. Coronary bypass surgery would be used to bypass obstructive vessels. Although cardiac catheterization can be used to assess the functional adequacy of the valves and heart muscle. In this case, the client has unstable angina and therefore would need the procedure to assess the extent of arterial blockage. The client who experiences angina has been told to follow a low cholesterol diet. Which of the following meals would be best? 1. Hamburger, salad, and milkshake. 2. Baked liver, green beans, and coffee. 3. Spaghetti with tomato sauce, salad, and coffee. 4. Fried chicken, green beans, and skim milk. The correct answer is 3. Spaghetti with tomato sauce, salad, and coffee. Rationale. Pasta, tomato sauce, salad, and coffee would be the best selection for the client following a low cholesterol diet. Hamburgers, milkshakes, liver, and fried foods tend to be high in cholesterol. The nurse is assessing an older adult with a pacemaker who leads a sedentary lifestyle. The client reports being unable to perform activities that require physical exertion. The nurse should further assess the client for which of the following? 1. Left ventricular atrophy. 2. Irregular heartbeats. 3. Peripheral vascular occlusion. 4. Pacemaker placement. The correct answer is 1. Left ventricular atrophy. Rationale. In older adults who are less active and do not exercise the heart muscle, atrophy can result. Disuse or deconditioning can lead to abnormal changes in the myocardium of the older adult. As a result, under sudden emotional or physical stress, the left ventricle is less able to respond to the increased demands on the myocardial muscle. Decreased cardiac output, cardiac hypertrophy, and heart failure are examples of the chronic conditions that may develop in response to inactivity, rather than in response to the aging process. Irregular heartbeats are generally not associated with an older sedentary adult's lifestyle. Peripheral vascular occlusion or pacemaker placement should not affect response to stress. A client with major depression and psychotic features is admitted involuntarily to the hospital. He will not eat because his bowels have turned to jelly, which the client states is punishment for his wickedness. The client requests to leave the hospital. The nurse denies the request because commitment papers have been initiated by the primary healthcare provider. Which of the following should the nurse identify as a criterion for the client to be legally committable? 1. Evidence of psychosis. 2. Being gravely disabled. 3. Risk of harm to self or others. 4. Diagnosis of mental illness. The correct answer is 2. Being gravely disabled. Rationale. Criteria for commitment include being gravely disabled and posing a harm to self or others. This client is not threatening to harm himself or to harm others. The client is gravely disabled because of his inability to care for himself, namely, not eating because of his delusion. Evidence of psychosis or psychotic symptoms or diagnosis of a mental illness alone does not make the client legally eligible for commitment. Crackles heard on lung auscultation indicate which of the following? 1. Cyanosis. 2. Bronchospasm. 3. Airway narrowing. 4. Fluid-filled alveoli. The correct answer is 4. Fluid-filled alveoli. Rationale. Crackles are auscultated over fluid-filled alveoli. Crackles heard on lung auscultation do not have to be associated with cyanosis. Bronchospasm and airway narrowing generally are associated with wheezing sounds. Prior to administering tissue plasminogen activator, TPA, the nurse should assess the client for which of the following contradictions to administering the drug? 1. Age greater than 60 years. 2. History of cerebral hemorrhage. 3. History of heart failure. 4. Cigarette smoking. The correct answer is 2. History of cerebral hemorrhage. Rationale. A history of cerebral hemorrhage is a contraindication to administration of TPA because the risk of hemorrhage may be further increased. Age greater than 60 years, history of heart failure, and cigarette smoking are not contraindications. After the administration of TPA, the nurse should 1. Observe the client for chest pain. 2. Monitor for fever. 3. Review the 12-lead electrocardiogram, ECG. 4. Auscultate breath sounds. The correct answer is 1. Observe the client for chest pain. Rationale. Although monitoring the 12-lead ECG and monitoring breath sounds are important, observing the client for chest pain is the nursing assessment priority because closure of the previously obstructed coronary artery may recur. Clients who receive TPA frequently receive heparin to prevent closure of the artery after administration of TPA. Careful assessment for signs of bleeding and monitoring of partial thromboplastin time are essential to detect complications. Administration of TPA should not cause fever. If the client displays risk factors for coronary artery disease, such as smoking cigarettes, eating a diet high in saturated fat, or leading a sedentary lifestyle, techniques of behavior modification may be used to help the client change the behavior. The nurse can best reinforce new adaptive behaviors by 1. Explaining how the risk factor behavior leads to poor health. 2. Withholding praise until the new behavior is well established. 3. Rewarding the client whenever the acceptable behavior is performed. 4. Instilling mild fear into the client to extinguish the behavior. The correct answer is 3. Rewarding the client whenever the acceptable behavior is performed. Rationale. A basic principle of behavior modification is that behavior that is learned and continued is behavior that has been rewarded. Other reinforcement techniques have not been found to be as effective as reward. A middle-aged adult with a family history of CAD has the following: total cholesterol 198, LDL cholesterol 120, HDL cholesterol 58, triglycerides 148, blood sugar 102, and C-reactive protein 4.2. The healthcare provider prescribes a statin medication and aspirin. The client asks the nurse why these medications are needed. Which is the best response by the nurse? 1. The labs indicate severe hyperlipidemia and the medications will lower your LDL along with a low-fat diet. 2. The triglycerides are elevated and will not return to normal without these medications. 3. The CRP is elevated, indicating inflammation seen in cardiovascular disease, which can be lowered by the medications prescribed. 4. These medications will reduce the risk of type 2 diabetes. The correct answer is 3. The CRP is elevated, indicating inflammation seen in cardiovascular disease, which can be lowered by the medications prescribed. Rationale. CRP is a marker of inflammation and is elevated in the presence of cardiovascular disease. The high sensitivity CRP is the blood test for greater accuracy in measuring the CRP to evaluate cardiovascular risk. The family history, postmenopausal age, LDL above optimum levels, and elevated CRP place the client at risk of CAD. Statin medications can decrease LDL, whereas statins and aspirin can reduce CRP and decrease the risk of MI and stroke. The blood sugar is within normal limits. The nurse is caring for a client who recently experienced a myocardial infarction and has been started on clopidogrel, Plavix. The nurse should develop a teaching plan that includes which of the following points? Select all that apply. 1. The client should report unexpected bleeding or bleeding that lasts a long time. 2. The client should take Plavix with food. 3. The client may bruise more easily and may experience bleeding gums. 4. Plavix works by preventing platelets from sticking together and forming a clot. 5. The client should drink a glass of water after taking Plavix. The correct answers are 1. The client should report unexpected bleeding or bleeding that lasts a long time. 3. The client may bruise more easily and may experience bleeding gums. And 4. Plavix works by preventing platelets from sticking together and forming a clot. Rationale. Plavix is generally well absorbed and may be taken with or without food. It should be taken at the same time every day, and while food may help prevent potential GI upset, food has no effect on absorption of the drug. Bleeding is the most common adverse effect of Plavix. The client must understand the importance of reporting any unexpected, prolonged, or excessive bleeding, including blood in urine or stool. Increased bruising and bleeding gums are possible side effects of Plavix. The client should be aware of this possibility. Plavix is an antiplatelet agent used to prevent clot formation in clients that have experienced or are at risk for myocardial infarction, ischemic stroke, peripheral artery disease, or acute coronary syndrome. It is not necessary to drink a glass of water after taking Plavix. After a myocardial infarction, the hospitalized client is taught to move the legs while resting in bed. The expected outcome of this exercise is to 1. Prepare the client for ambulation. 2. Promote urinary and intestinal elimination. 3. Prevent thrombophlebitis and blood clot formation. 4. Decrease the likelihood of pressure ulcer formation. The correct answer is 3. Prevent thrombophlebitis and blood clot formation. Rationale. Encouraging the client to move the legs while in bed is a preventive strategy taught to all clients who are hospitalized and on bed rest to promote venous return. The muscular action aids in venous return and prevents venous stasis in the lower extremities. These exercises are not intended to prepare the client for ambulation. These exercises are not associated with promoting urinary and intestinal elimination. These exercises are not performed to decrease the risk of pressure ulcer formation. Which of the following is an expected outcome when a client is receiving an IV administration of furosemide? 1. Increased blood pressure. 2. Increased urine output. 3. Decreased pain. 4. Decreased premature ventricular contractions. The correct answer is 2. Increased urine output. Rationale. Furosemide is a loop diuretic that acts to increase urine output. Furosemide does not increase blood pressure, decrease pain, or decrease arrhythmias. The nurse is developing a teaching plan for a client who will be starting a prescription for Zocor, simvastatin, 40 milligrams per day. The nurse should instruct the client about which of the following? Select all that apply. 1. Take once a day in the morning. 2. If you miss a dose, take it when you remember it, but do not double the dose if you do not remember to take it until it is time for your next dose. 3. Limit greens such as lettuce in the diet to prevent bleeding. 4. Be sure to take the pill with food. 5. Report muscle pain or tenderness to your healthcare provider. 6. Continue to follow a diet that is low in saturated fats. The correct answers are 2. If you miss a dose, take it when you remember it, but do not double the dose if you do not remember to take it until it is time for your next dose. 5. Report muscle pain or tenderness to your healthcare provider. And 6. Continue to follow a diet that is low in saturated fats. Rationale. Zocor, simvastatin, is used in combination with diet and exercise to decrease elevated total cholesterol. The client should take Zocor in the evening, and the nurse should instruct the client that if a dose is missed, to take it as soon as remembered, but not to take at the same time as the next scheduled dose. It is not necessary to take the pill with food. The client does not need to limit greens. Limiting greens is appropriate for clients taking Coumadin, but the nurse should instruct the client to avoid grapefruit and grapefruit juice, which can increase the amount of the drug in the bloodstream. A serious side effect is myopathy, and the client should report muscle pain or tenderness to the healthcare provider. How should the nurse instruct the client with unstable angina to use sublingual nitroglycerin tablets when chest pain occurs? 1. Sit down and then take 1 tablet every 2 to 5 minutes until the pain stops. 2. Sit down and then take 1 tablet and rest for 15 minutes. Call the physician if pain persists after 15 minutes. 3. Sit down and then take 1 tablet. Then if the pain persists, take additional 2 tablets in 5 minutes. Call the physician if pain persists after 15 minutes. 4. Sit down and then take 1 tablet. If pain persists after 5 minutes, call 911. The correct answer is 4. Sit down and then take 1 tablet. If pain persists after 5 minutes, call 911. Rationale. The nurse should instruct the client that correct protocol for using sublingual nitroglycerin involves immediate administration when chest pain occurs. Sublingual nitroglycerin appears in the bloodstream within 2 to 3 minutes and is metabolized within about 10 minutes. The client should sit down and place the tablet under the tongue. If the chest pain is not relieved within 5 minutes, the client should call 911. Although some physicians may recommend taking a second or third tablet spaced 5 minutes apart and then calling for emergency assistance, it is not appropriate to take 2 tablets at once. Nitroglycerin acts within 2 to 3 minutes, and the client should not wait 15 minutes to take further action. The client should call 911 to obtain emergency help rather than calling the physician. The client is scheduled for a percutaneous transluminal coronary angioplasty to treat angina. Priority goals for the client immediately after PTCA should include 1. Minimizing dyspnea. 2. Maintaining adequate blood pressure control. 3. Decreasing myocardial contractility. 4. Preventing fluid volume deficit. The correct answer is 4. Preventing fluid volume deficit. Rationale. Because the contrast medium used in PTCA acts as an osmotic diuretic, the client may experience diuresis with resultant fluid volume deficit after the procedure. Additionally, potassium levels must be closely monitored because the client may develop hypokalemia due to the diuresis. Dyspnea would not be anticipated after this procedure. Maintaining adequate blood pressure control should not be a problem after the procedure. Increased myocardial contractility would be a goal, not decreased contractility. As an initial step in treating a client with angina, the physician prescribes nitroglycerin tablets, 0.3 milligrams given sublingually. This drug's principal effects are produced by 1. Antispasmodic effects on the pericardium. 2. Causing an increased myocardial oxygen demand. 3. Vasodilation of peripheral vasculature. 4. Improved conductivity in the myocardium. The correct answer is 3. Vasodilation of peripheral vasculature. Nitroglycerin produces peripheral vasodilation, which reduces myocardial oxygen consumption and demand. Vasodilation in coronary arteries and collateral vessels may also increase blood flow to the ischemic areas of the heart. Nitroglycerin decreases myocardial oxygen demand. Nitroglycerin does not have an effect on pericardial spasticity or conductivity in the myocardium. Which of the following symptoms should the nurse teach the client with unstable angina to report immediately to the physician? 1. A change in the pattern of the chest pain. 2. Pain during sexual activity. 3. Pain during an argument. 4. Pain during or after a physical activity. The correct answer is 1. A change in the pattern of the chest pain. Rationale. The client should report a change in the pattern of chest pain. It may indicate increasing severity of coronary artery disease. Pain occurring during stress or sexual activity would not be unexpected, and the client may be instructed to take nitroglycerin to prevent this pain. Pain during or after an activity, such as lawn mowing, also would not be unexpected. The client may be instructed to take nitroglycerin to prevent this pain or may be restricted from doing such activities. Following diagnosis of angina pectoris, a client reports being unable to walk up 2 flights of stairs without pain. Which of the following measures would most likely help the client prevent this problem? 1. Climb the steps early in the day. 2. Rest for at least an hour before climbing the stairs. 3. Take a nitroglycerin tablet before climbing the stairs. 4. Lie down after climbing the stairs. The correct answer is 3. Take a nitroglycerin tablet before climbing the stairs. Rationale. Nitroglycerin may be used prophylactically before stressful physical activities, such as stair climbing, to help the client remain pain-free. Climbing the stairs early in the day would have no impact on decreasing pain episodes. Resting before or after an activity is not as likely to help prevent an activity-related pain episode. A 68-year-old client on day 2 after hip surgery has no cardiac history, but reports having chest heaviness. The first nursing action should be to 1. Inquire about the onset, duration, severity, and precipitating factors of the heaviness. 2. Administer oxygen via nasal cannula. 3. Offer pain medication for the chest heaviness. 4. Inform the physician of the chest heaviness. The correct answer is 1. Inquire about the onset, duration, severity, and precipitating factors of the heaviness. Rationale. Further assessment is needed in this situation. It is premature to initiate other actions until further data have been gathered. Inquiring about the onset, duration, location, severity, and precipitating factors of the chest heaviness will provide pertinent information to convey to the physician. Which of the following comments indicates that a client understands the nurse's teaching about sertraline? 1. Zoloft will probably cause me to gain weight. 2. This medicine can cause decreased libido. 3. Dry mouth is a permanent side effect of Zoloft. 4. I can take my medicine with St. John's wort. The correct answer is 2. This medicine can cause decreased libido. Rationale. Sertraline, like other selective serotonin reuptake inhibitors, SSRIs, can cause decreased libido. SSRIs do not typically cause weight gain, but may cause loss of appetite and weight loss. Dry mouth is a possible side effect, but it is temporary. The client should be told to take sips of water, suck on ice chips, or use sugarless gum or candy. St. John's wort should not be taken with SSRIs because a severe reaction could occur. A client has driven himself to the emergency department. He is 50 years old, has a history of hypertension, and informs the nurse that his father died from a heart attack at age 60. The client has indigestion. The nurse connects him to an electrocardiogram monitor and begins administering oxygen at 2 liters per minute per nasal cannula. The nurse's next action should be to 1. Call for the physician. 2. Start an IV infusion. 3. Obtain a portable chest radiograph. 4. Draw blood for laboratory studies. The correct answer is 2. Start an IV infusion. Rationale. Advanced Cardiac Life Support recommends that at least 1 or 2 IV lines be inserted in one or both of the antecubital spaces. Calling the physician, obtaining a portable chest radiograph, and drawing blood for the laboratory are important but secondary to starting the IV line. When monitoring a client who is receiving tissue plasminogen activator, TPA, the nurse should have resuscitation equipment available because reperfusion of the cardiac tissue can result in which of the following? 1. Cardiac arrhythmias. 2. Hypertension. 3. Seizure. 4. Hypothermia. The correct answer is 1. Cardiac arrhythmias. Rationale. Cardiac arrhythmias are commonly observed with administration of TPA. Cardiac arrhythmias are associated with reperfusion of the cardiac tissue. Hypotension is commonly observed with administration of TPA. Seizures and hypothermia are not generally associated with reperfusion of the cardiac tissue. Alteplase recombinant or tissue plasminogen activator, TPA, a thrombolytic enzyme, is administered during the first 6 hours after onset of myocardial infarction to 1. Control chest pain. 2. Reduce coronary artery vasospasm. 3. Control the arrhythmias associated with MI. 4. Revascularize the blocked coronary artery. The correct answer is 4. Revascularize the blocked coronary artery. Rationale. The thrombolytic agent TPA, administered intravenously, lyses the clot blocking the coronary artery. The drug is most effective when administered within the first 6 hours after onset of MI. The drug does not reduce coronary artery vasospasm. Nitrates are used to promote vasodilation. Arrhythmias are managed by antiarrhythmic drugs. Surgical approaches are used to open the coronary artery and reestablish a blood supply to the area. The client has been managing angina episodes with nitroglycerin. Which of the following indicate the drug is effective? 1. Decrease chest pain. 2. Increase blood pressure. 3. Decrease blood pressure. 4. Decreased heart rate. The correct answer is 1. Decrease chest pain. Rationale. Nitroglycerin acts to decrease myocardial oxygen consumption. Vasodilation makes it easier for the heart to eject blood, resulting in decreased oxygen needs. Decreased oxygen demand reduces pain caused by heart muscle not receiving sufficient oxygen. While blood pressure may decrease ever so slightly due to the vasodilation effects of nitroglycerin, it is only secondary and not related to the angina the patient is experiencing. Increased blood pressure would mean the heart would work harder, increasing oxygen demand and thus angina. Decreased heart rate is not an effect of nitroglycerin. Which client is at greatest risk for coronary artery disease? 1. A 32-year-old female with mitral valve prolapse who quit smoking 10 years ago. 2. A 43-year-old male with a family history of CAD and cholesterol level of 158. 3. A 56-year-old male with an HDL of 60 who takes atorvastatin. 4. A 65-year-old female who is obese with an LDL of 188. The correct answer is for a 65-year-old female who is obese with an LDL of 188. Rationale. The woman who is 65 years old, overweight, and has an elevated LDL is at greatest risk. The combination of postmenopausal obesity and high LDL places this client at greatest risk. Which of the following is the most appropriate diet for a client during the acute phase of myocardial infarction? 1. Liquids as desired. 2. Small, easily digested meals. 3. 3 regular meals per day. 4. Nothing by mouth. The correct answer is 2. Small, easily digested meals. Rationale. Recommended dietary principles in the acute phase of MI include avoiding large meals because small, easily digested foods are better tolerated. Fluids are given according to the client's needs, and sodium restrictions may be prescribed, especially for clients with manifestations of heart failure. Cholesterol restrictions may be prescribed as well. Clients are not prescribed diets of liquids only or restricted to nothing by mouth unless their condition is very unstable. A client has had a pulmonary artery catheter inserted. In performing hemodynamic monitoring with a catheter, the nurse will wedge the catheter to gain information about which of the following? 1. Cardiac output. 2. Right atrial blood flow. 3. Left end diastolic pressure. 4. Cardiac index. The correct answer is 3. Left end diastolic pressure. Rationale. When wedged, the catheter is pointing indirectly at the left end diastolic pressure. The pulmonary artery wedge pressure is measured when the tip of the catheter is slowing inflated and allowed to wedge into a branch of the pulmonary artery. Once the balloon is wedged, the catheter reads the pressure in front of the balloon. During diastole, the mitral valve is open, reflecting left ventricular end diastolic pressure. Cardiac output is the amount of blood ejected by the heart in 1 minute and is determined through thermodilution and not wedge pressure. Cardiac index is calculated by dividing the client's cardiac output by the client's body surface area and is considered a more accurate reflection of the individual client's cardiac output. Right atrial blood pressure is not measured with the pulmonary artery catheter.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.